have Roseanne Donnelly from Massachusetts College of Pharmacy and Health Sciences, and she's going to speak on improving the genomic literacy of healthcare professionals through the Inter-Society Coordinating Committee of the Practitioner Education in Genomics.
Hi, everyone. It's really a pleasure to be here today. We just had two outstanding talks in this session on education. The first one focused on student education and the second on postgraduate trainee education. So I'm going to round us out and talk about clinician education, and specifically through the lens of what we're doing in this group called the Inter-Society Coordinating Committee for Practitioner Education in Genomics. Please do not ask me to say that 10 times fast. Brevity is clearly not a strength of our group. And that brings us to the learning objective for my session is to really focus on how ISCC PEG, which I will refer to it as, is improving genomic literacy for healthcare professionals, particularly in pharmacogenomics. So we all know in this room that genomics is here. A lot of exciting advancements in this space, both in terms of disease treatment and prevention, and especially obviously in the field of pharmacogenomics, as we're aware. But the key question is, are our healthcare professionals ready to do this? And we do actually have quite a few studies out there that have explored this question, many survey-based studies of physicians, of pharmacists, other healthcare professionals, asking about their perceptions of pharmacogenomics and how if they feel ready to do this in practice. And by and large, study after study has shown really two main conclusions that have come out of these. One is that healthcare professionals, the majority of them believe that pharmacogenomics is important for patient care, majority in all these studies, but at the same time, the majority of healthcare professionals are not confident in their pharmacogenomics knowledge and skills. And so that brings us to the question of how can we bridge this gap? Right? What can we do in order to help the situation? And one way in which we can do that, right, is through education, which is the topic of what we're talking about today. And one organization that's really focused on trying to advance that education is ISCC PEG. So I want to tell you a little bit more about our mission and what we have been working on. So again, ISCC PEG is a group that was established back in 2013 through the National Human Genome Research Institute. It actually was an initiative that emerged from one of those genomic medicine meetings that Dr. Manolio talked a little bit about yesterday. And the mission of the group is to improve the genomic literacy of healthcare providers and enhance the effective practice of clinical genomic medicine by facilitating interactions among key stakeholders in genomics education. And through ISCC PEG, members can collaborate to identify educational needs and potential solutions, share best practices and educational approaches, and develop educational resources. And on the bottom of the slide, I have the two co-chairs of ISCC PEG, Dr. Donna Messersmith and Dr. Richard Haspel. So within this mission, we have really three main overarching goals. One is to gather and facilitate dissemination of best practices and resources in genomics education and promote their translation into evidence-based clinical care. Second, to assist key stakeholders, including societies, professional organizations, NIH institutes, industry, and individuals with expertise in medical education in identifying gaps and barriers in genomics education for healthcare providers. And finally, to actually develop those resources to promote healthcare provider education and the effective practice of clinical genomic medicine. So what I think is really a key strength of this group is that we are multidisciplinary. So this group has representatives from 61 different professional organizations, 11 government institute groups, 8 companies, and we really have representation from across the healthcare spectrum. We have pharmacists, physicians, nurses, PAs, genetic counselors, scientists as well, and I think this really is the strength of this group to come together to try to tackle this challenge of genomics education for healthcare professionals. I borrowed this slide from Dr. Haspel when he presented at our annual meeting a couple of months ago to show the different organizations that have official representation within ISCC PEG. So you can see from looking at this slide, there are a number of prominent medical associations here, pharmacy associations. We have CPIC and PharmGKB, different companies within industry as well. Again, all having representation in ISCC PEG. So this group really is focused on genomics education broadly, and so it is separated into smaller project groups. So members can volunteer their time to work in these different areas based on their areas of interest and expertise. So at the present time, there are 9 project groups, as you can see here. And this is a dynamic list, so this may evolve over time depending on member interest. So started out as a smaller number of groups. This has grown over time. So it's a great organization because it really is amenable to the needs and interests of the members. And one of the more long-standing project groups is the Pharmacogenomics Project Group. And so I'd like to tell you a little bit more about some of our focus areas and achievements over the past couple of years. So within this, the ISCC PEG project group, Pharmacogenomics Project Group, I have the pleasure of serving as co-chair of this group with Dr. Phil Empey. We currently have over 50 members, again, multidisciplinary within this group, and a number of different goals around pharmacogenomics education for healthcare professionals. So I want to focus a little bit on and my box is a little off on this slide, but goal number 1 here, creating and repurposing pharmacogenomics educational content targeted towards clinicians. And one of our major projects over the last couple of years is this ISCC PEG Pharmacogenomics Learning Series. And this is right now live on the NHGRI website, and I'll have a QR code in a few slides if you wanted to see that website. But this is a learning series that is developed by our members, so expert content in pharmacogenomics, covering a variety of contemporary topics in the field, really designed it to have high accessibility, to be for all healthcare professionals and have broad dissemination. And yeah, it's looking like the formatting here is a little off from when I put this together, so I apologize for that. This is the list of modules that are currently represented in the learning series. You can see that we have 4 modules that are currently live online now. We have learners who are actively engaging with those. And we have 5 more modules that are in the works and hopefully will be online soon. So I just want to show you a little bit more about what these modules look like. So again, these are online modules. These are self-paced, accessible, available on demand. And this is the landing page where you would enroll in the various modules here. And I'll show you some screenshots to give you a feel for what these are like. So these are largely text-based, but we did try to design them to be highly interactive with cases and debrief. So for example, from the resources module, a little bit about CPIC there. There are cases that are embedded throughout to help kind of bring the real-world angle into this. As well as self-assessment questions, multiple choice, select all that apply, that gives the learner real-time feedback in how they are absorbing that content and being able to apply that. And with the system that we're using, there are some other types of questions that we incorporate that engage the learner, so you can take this card here and drag it to the appropriate area. So this activity is involving the learner going out to the FDA table of pharmacogenetic associations and then looking at a gene-drug pair and trying to match it up to where they can find that relevant information. And similarly, directing the learner to the CPIC genes drugs page, for instance, and then having matching gene-drug pairs to different levels to kind of get a feel for that content. So basic topics here, ones that, everyone here is probably familiar with these concepts, but I think we all might know individuals who could benefit from kind of a foundational primer on pharmacogenomics, some basic concepts. It is free to learn with all of these modules, freely available. You can share it now. There is, however, some continuing education available for clinicians for a small fee if clinicians wanted to do that. You don't have to, but it is available for pharmacists, physicians, nurses, and PAs. So because this was targeted at clinicians, we thought that'd be a nice add-on in case people were interested. And we are appreciative of our partner, our University of Pittsburgh School of Pharmacy, who's helping us to produce and host these modules online. So again, QR code is here for the landing page, so please check it out and feel free to share it with your colleagues. I just want to give everyone a little bit of a sense of our enrollment so far with these modules. Many thanks to Phil for providing this data that you're seeing here. So what you're looking at is each of the 4 live modules corresponds to a color here. The arrows represent the launch dates for those specific modules, and you can see the growth over time. So cumulative to date, 553 individual registrations across these 4 courses so far with very little marketing. And so, we really haven't done a huge push yet because we're still getting the rest of them on there, but the word is slowly getting out, and we actually have had some international learners as well. So it's great to see that this is already starting to help individuals. All right, so going back to our goals here, I also wanted to touch upon goal number 2, and again, sorry about the box. I wish I could just tip that up a little bit, to goal number 2 about preparing for presentations at clinician professional meetings and what our group has done to advance that goal. And so we have a member within our ISCC PEG Pharmacogenomics Project Group, Dr. Bob Ostrander, who's a family medicine physician, very interested in pharmacogenomics. And he's our liaison to the American Academy of Family Physicians, or AAFP. And so because he has that contact with AAFP, he's able to work with them to help get educational sessions at their annual meeting and try to get some pharmacogenomics sessions in there. And so he also comes back to our project group to ask for input on the content of these sessions and to help with that. And so it just shows, I think, the collaboration that can occur here and how having members who are tapped into these different maybe medical associations that don't have a focus on pharmacogenomics, we can help try to spread the word a little bit and try to meet clinicians where they are getting their continuing education. So we started this back in 2021. I co-presented with Dr. Ostrander at the FMX, or the AAFP annual meeting, and then he's done presentations every year since then, with the next one coming up this fall and at their annual meeting, and with a focus on mental health. So it's been a really successful partnership there. All right, so going back to our project groups, that's a little bit of what I wanted to cover with the pharmacogenomics group specifically, but I did want to touch upon the direct-to-consumer genetic testing project group as well, because there's been a little bit of cross-pollination between their group and our pharmacogenomics group. And that's because we have a nice area of overlap, right, between these 2 areas with direct-to-consumer pharmacogenomic testing. So I want to highlight how we have intergroup collaboration in this space and helping to advance pharmacogenomics knowledge within the DTC space specifically. So the ISCC PEG direct-to-consumer genetic testing project group focuses on DTC genetic testing in general. And we have 2 co-chairs, Dr. Weiler and Dr. Ubier, over 30 members in this group, again, multidisciplinary, several goals here related to assessing the need for direct-to-consumer genetic testing education for clinicians and developing resources to meet that need. So one project that has been really successful that came out of the direct-to-consumer genetic testing project group is the creation of a direct-to-consumer genetic testing FAQ for healthcare professionals. This is live on the NHGRI website, as you can see here, and is a nice resource to share with clinicians if they have questions about direct-to-consumer genetic testing and how that might impact, what are the benefits and limitations of these tests, how might that impact their patients' care, need for confirmatory testing, and medical decision-making. This is the table of contents, what's included in that DTC GT FAQ. And I want to just point out there is a specific section on direct-to-consumer pharmacogenomic testing, and that's where experts from the Pharmacogenomics Project Group was able to weigh in and contribute this piece and have a nice collaboration there. One other project that was cross-collaboration between these two groups is a manuscript entitled When Patients Present with Direct-to-Consumer Pharmacogenomic Test Results. This is something that we're aiming to get published in a general medicine journal. We don't want to be preaching to the choir, to the pharmacogenomics group, but can we get this out into a general medicine journal? We responded to reviewer comments, fingers crossed, it gets accepted, so we're still waiting on that. But this is really geared to be a step-by-step guide for, if a clinician, general practice is presented with these direct-to-consumer pharmacogenomic test results, what are the steps they should take to think about that? What can they use in clinical practice? What can't they? Do they need confirmatory clinical testing and all of that? And I just want to highlight again kind of the multidisciplinary effort here. In our small author group, we have pharmacists, physicians, a genetic counselor, scientists, again, cross-collaboration between the two groups. And it's just, I think, a really nice example of what we can do working together in this way. All right, so another resource I wanted to make sure everyone was aware of is the Genomics Education Resource Center, or Genome Ed, which is, again, available through the NHGRI website. Some of you may have heard of the Genetics Genomics Competency Center, or G2C2. This is the new and improved G2C2, essentially, which is basically a free repository of genomics education resources. So if you didn't know where to go to find educational resource about genomics in general, this is a nice place to check to see if there's something that may meet your needs. And you can search this repository. You can search by topic, as you can see here. I have it filtered on pharmacogenomics right now, but there's other topic areas. The format, is there a CE associated with it? Is it a free or a paid resource? And so it's just a nice spot to go if you're just looking for these types of resources. All right, so maybe at this point you're like, this sounds really cool and interesting, and I'm interested in genomics education too. And to that I would say, definitely look into joining ISCC PEG. The website is genome.gov/ISCC, and it is a free group to join. So, we'd love to have you, especially within the Pharmacogenomics Project Group, or really any other project group that may meet your interests. And I do also want to mention, too, for those of you who work with students, there's a really nice scholars program for students that they would apply to. And if they're accepted to this program, they would have the opportunity to work on a mentored project in genomics education with one of the members of one of the project groups. Really nice opportunity for our students. All right, so just to bring everything full circle, right, the goal here, what we're all trying to do and working towards is, again, bridging that gap with education so that healthcare professionals not only believe that pharmacogenomics is important for patient care, but are also confident in their knowledge and skills. And please move that red line to the not. Yes. Thank you. And then, obviously the goal then is to improve pharmacogenomics implementation and ultimately improve patient care outcomes. So with that, just a few acknowledgments to conclude here. Of course, NHGRI for their support of ISCC PEG since its inception. Our co-chairs of ISCC PEG, Drs. Messersmith and Haspel. Beth Tuck, who's the NHGRI Education and Community Involvement Branch Chief, who's been very supportive of our efforts. Special shout out to Dr. Empey, who's been the co-chair of the Pharmacogenomics Project Group for a couple of years before I joined, so really want to thank him for his leadership. The Direct-to-Consumer Genetic Testing Project Group co-chairs, and then, of course, all of our members of ISCC PEG. These are volunteers who are taking their time to work on these important projects, and we really appreciate all of their efforts. Thank you very much.